Hello everyone. Welcome to anatomy class. We are studying lower limb. We completed most of the topics in the lower limb. So, we have only two topics remaining. One is venous drainage and arch of foot. Let's talk about those things in detail. Today, we will talk about venous drainage. Today, we will talk about venous drainage in the lower limb. Basically, in the lower limb, the venous drainage having three major veins. Three major veins. Three types of veins involved in the venous drainage. One is deep vein. Second one is superficial veins. And third one is perforating veins. Deep veins are travel along with the arteries. Okay. Superficial veins are, you can see on the superficial side, perforating veins which connects deep veins and superficial veins. So that is very, very important. So in the first, we have to talk with about the superficial vein of the lower limb. Superficial veins of the lower limbs. First, we will talk about superficial veins of the lower limb. So we had only two veins. One is GSV and second one is SSV. GSV means great Cephanius vein, and here small Cephanius vein. So we have two types of veins. Let's start with the image. We'll understand about that. So you can see this is the great Cephanius vein. Here it is beginning with this is the arch of the foot, dorsal arch of the foot, and here you can see it from the great toe. You can able to see this starting. This is great Cephanius vein. Great Cephanius vein is going travel behind the knee, and it is coming to the front of the thigh, and it is depositing its material into femoral vein, drain into femoral vein. And this is the small Cephanius vein. It is, you can see this is traveling backside of the knee, uh, knee here, uh, ankle joint. Okay, it is traveling behind the ankle joint. It is going backward to the calf region, and it is entering into the popliteal region, and it is entering into the popliteal vein. From that, it enter into the popliteal vein and goes to the same. It enter into the femoral vein. Okay, so this is the great and small Cephanius vein. The great Cephanius vein having its branches. Okay, so while it going from the dorsal, actually great Cephanius vein, it is going medial size, and small Cephanius one is going in lateral side. It is malleolus bone, great malleolus bone. Here you can see that this is front of the malleolus bone. It is behind the malleolus bone. So great Cephanius vein having these branches. Okay, it is traveling from here's arc of the foot, and it is going front of the malleolus bone like this, and having anterior branch, this is posterior branch, and it is going into the high region. Again, it have one branch, anterior is posterior, and it is entering into the femoral vein. Again, it have three branches. You can see this is okay. This is great saphenous vein. Great saphenous vein. This is small saphenous vein. It is starting from the dorsal venous arch. Okay, behind here behind. Okay, this is front. It is behind the malleus bone and going back to the calf region and going down into the popliteal vein, and it is inserted. You can see there are the branches, common branches, gastrocnemius vein, common trunk. Okay, so these are the other branches of popliteal vein. So all, even great saphenous vein, small saphenous vein, okay, they are draining the venous drainage. You can see this is the arch of the foot. This is the great saphenous vein. This is small saphenous. Okay, great saphenous vein. It is entering to the femoral vein. This is great saphenous vein. This is the popliteal vein. It is inserted here to popliteal vein. Okay, so this is the about small and great saphenous vein. This is the important thing. Tributaries also we discussed. This is the tributaries. These are the tributaries branches. Okay. Now we will talk about deep veins of the limbs. Now we'll talk about deep veins of the limbs. There are uh, three veins in the deep region, deep veins of the limbs. One is femoral vein, one is femoral vein, second one is popliteal vein, and third one is anterior and posterior tibial vein. Anterior and posterior tibial vein. Okay. So it is going along with the arteries. We have femoral artery, popliteal artery, anterior and posterior tibial artery. So they are going along with the veins. You can see this is the you can see this is the arch. Okay. Here going here you going great saphenous vein. This is the small saphenous vein. You can see this is the deeper vein. Okay. Deep posterior tibial vein. This is okay. Peroneal vein. This is anterior tibial vein. This is short saphenous popliteal vein. Okay, this is femoral vein. So these are the superficial. These are the superficial. These are the deeper popliteal vein. We have three types of veins. Na deep femoral vein and anterior tibial vein, posterior tibial vein. This is the anterior tibial vein. This is the posterior tibial vein. This is popliteal vein. So one, two, three, and four. Already popliteal vein we discussed. So these are three veins, deeper veins. One is femoral vein, popliteal vein, anterior tibial vein, and posterior tibial vein. So these are the superficial, these are the deep veins. Superficial, great saphenous vein and small saphenous vein. Deeper, popliteal vein, femoral vein, anterior and posterior tibial veins. So okay. So some veins are connecting the deeper vein to the superficial vein. So those are called perforating vein. You can see these are the perforating veins. You can see these are the perforating veins. These are the perforating veins. Like this is the one perforating vein. Okay. And these are the one perforating vein. You can see these are the perforating veins. These are the perforating veins. These are the perforating veins connecting. Perforating veins. First, venous drainage occurs in the superficial. Then, with the help of perforating vein, it enter into the deeper veins. From that, they will goes to the femoral vein. Okay. So where are the perforating veins are there? Perforating veins. Where are the area of perforating veins? So these are the perforating veins. So let's see the areas where the perforating veins are there. They are connected with deeper and superficial veins. So what perforating veins do? Perforating veins connect the deep veins to the to superficial veins. First, blood goes blood goes from superficial veins to deep veins through the perforating veins. Through the perforating veins. It is very important. And the second thing is that in the veins we have the valves. In the veins, in the veins, valves are present. Valves are present to prevent black flow. To prevent back flow. Okay. So what will happen? Sometimes these valves will damage. So valves are present in superficial veins. Valves are present in perforating veins. Valves are present in deep veins. Okay. So this is very important. So where the perforating veins are present? So first it is present in the leg, medial ankle, medial side. In the second leg, lateral ankle, lateral side. And third is knee at the knee joint, knee knee perforator just below knee. Next is mid thigh at the adductor canal, at the adductor canal. Okay, here which veins are connected? Great saphenous vein to femoral vein. Here in the leg, sorry, it is leg area. No? Sorry, one thing miss mistake happened. Okay, let correct the mistake. Leg in the leg side, medial side. Okay, great saphenous, not posterior arch, posterior arch vein to posterior tibial vein here, posterior tibial vein. Lateral side, short saphenous vein to peroneal vein. Here, great saphenous vein to posterior tibial vein. In the mid, great saphenous vein to femoral vein. So deep veins, these are the deep vein, posterior tibial vein, posterior popliteal vein, posterior vein, popliteal vein, and femoral vein. These are the deep veins. And these are the small cephalic veins, great cephalic veins. These are the superficial veins. So at that junction, we have perforating veins like this. So first, this is the arch. So this is the posterior, this is the three perforating veins present in the leg region. One is behind the knee. Okay, it is lateral side. This is the no, this is medial side, this is lateral side. This is knee, at the knee area. It is at this is at mid of the thigh. Okay. These are the four areas where one, two, three, four areas where you will able to see the perforating veins. Okay. So what happened? You can see these are the walls present. Okay. These are the walls are present. Walls are present. So what will happen? It prevent the backflow. Whoever are the teachers, okay, job holders, okay, like uh, they have to stand for long hours. So gravitational force pulls back the blood towards the legs. So what will happen? The valves cannot bear the weight for longer duration. So gradually the walls become loosened and it will damage. So what will happen? Due to the damage of valves, blood flow is disturbed. Damage of the valves. So damage will happen at the superficial level. Damage will happen at the perforating level. Damage will happen on the deep level. So according to the condition, the symptoms are to be seen, or you can see the spider webs like structure. These are the spider leg web structures, small structure. Someone have from ankle joint to the knee joint. Someone will have at the thigh joint. Okay, because of this damage of the wall, the blood leaks into the muscles. Okay, so it is very important. So we will perform some test which will give the idea which valve or which vein is damaged. So according to the condition, you do this test. So you can see these are the damaged veins. So due to this, the person will develop ulcer also, non-healing ulcer sometimes. So in the clinical cases, you will able to see two cases mostly. That is varicose veins. One is ulcer, non-healing ulcers. Okay. So this is all about the venous drainage of lower limb. So we have one more topic, that is arches of the foot. So we will study in tomorrow class. Thank you. Thank you very much.